Welcome to the Regenerative Healing Show. This is Dr. Warren Slaten, and this is our second episode. I hope you watched our first episode where I showed you our great office. And today I'm going to talk about prolotherapy, and I've chosen prolotherapy as my first clinical discussion, and the reason is because it's such a great treatment. And why is it such a great treatment? Because it treats so many pain conditions such as arthritis, tendonitis, sprains, so many musculoskeletal pain conditions, and it does it naturally. And what's really great about it is it does it for long-term healing. So it's not a quick fix, it is long-term healing. So what is prolotherapy? Prolotherapy is the use of a regenerative solution, usually dextrose, that creates a mild irritation, usually at a ligament or a tendon or in a joint, and that mild irritation leads to blood flow. And what's great about that blood flow is that blood flow leads to healing. So there are certain conditions such as a muscle strain. Well, muscles heal quickly. So if you strain your hamstring, and I've done that once or twice, when you strain it, you get a lot of, you might even see bruising in the area. Well, you're getting a lot of blood flow to that area. And the good news about that blood flow is it leads to quick healing. So that hamstring strain is going to heal in 2 to 3 weeks usually. And on the other hand, when you strain a ligament, strain a tendon, now that tendon and ligament is going to take a lot longer to heal. So let's look at the muscle here. What you see is it's reddish appearance, okay? And that reddish appearance indicates that there's blood flow there. On the other hand, let's look at this ligament, let's look at this tendon, and that is yellow-white or white, but what you don't see there is red, and that's because it's not getting blood flow. So when you injure your ligament or tendon, it heals very slowly. So we have prolotherapy that provides a way of bringing in blood flow. When you put in prolotherapy, it leads to blood flow. It's like calling out to the body, send growth factors over here where the injury is. And what those growth factors do, they go there, they respond to that, and when they get there, they heal the ligament and the tendon. They help lay down new tissue so the ligament and tendon grows stronger. So it's not just a quick fix like a steroid injection, it's a long-term solution. A steroid injection is not a long-term fix because it's not getting to the root of the problem, the mechanical problem that caused the pain and the breakdown of the tendon and ligament in the first place. What it's doing is it's relieving pain. Well, that's great, but then when it wears off, the steroid injection wears off, then the pain is right back there. So when it's right back there, you're back where you were, and your tendon or ligament might even be a little weaker because you can't get repeat steroid injections because they wear away at tissue. And on the other hand, prolotherapy is such a phenomenal treatment because it builds tissue. It builds tissue for tendon problems, ligament problems, joint problems. And when it builds that tissue, again, it's not just a quick fix, it's a long-term solution. And that's why prolotherapy is such a great treatment, and that's why I've chosen prolotherapy as my first clinical discussion with you, so you can learn more about this in subsequent shows that I put on, and I look forward to that next week.